Hello, Introduction to Kinesiology students. My name is Dr. Cosby and I will be lecturing in the online platform. Unfortunately, I cannot make it personally to Kines 101, and I thought this topic is so important to the foundation of a freshman or a sophomore that it really needed to be integrated into the course. So the topic that I was assigned was evidence-based practice as the gold standard in medical care. If you know anything about healthcare professionals, what you know the buzzword is right now is evidence-based practice. Nurses have been doing it for a very long time, and physicians are starting to hop on that train. But believe it or not, our PAs, our PTs, and our ATCs are now incorporating evidence-based practice into patient evaluation and assessment, and also patient treatment. So it becomes important to start building the foundation for what you'll be doing when you leave Point Loma. So my topic is going to be Introduction to Evidence-Based Practice. In other words, what is it and kind of how you do that, and then how to write a really good clinical question. And this second piece really becomes important for the major assignment in Kines 101, which is your literature review. It will actually help you, in essence, search for really good quality clinical research articles that can help you write a more succinct and precise and accurate literature review. So our first stop is really the Kines 101 topics that have been assigned to the class. There are 4 topics that each of you can choose from, and those 4 topics are the health benefits of HIIT versus continuous exercise training, the prevention and treatment of medial tibial stress syndrome, or as some of you know it, shin splints, the treatment practices of lateral epicondylitis, and then last but definitely not least would be the benefits of activity, specifically exercise, on Alzheimer's disease. So you will be asked to choose one of these topics and then to write a robust, lengthy literature review. And so I want to teach you how to do this in such a way that you get recent research articles and good clinical articles that could maybe even help you at some point in time treat these patients or drive patient treatment. So what is evidence-based practice, or EBP? Evidence-based practice is the integration of 3 different components. The first component is clinical expertise. And by the time you guys leave here and by the time you get your certification or become a physical therapist or become a doctor or a physical therapist or a certified athletic trainer or a chiropractor, right? By the time you leave us or you leave graduate school, you will have a wealth of clinical expertise. And so for most clinicians who practice evidence-based, what we see is that clinical expertise is just the natural piece or component to them. But like I said, it's this integration of 3 different components. So clinical expertise comes very naturally to us as clinicians. However, the 2 that don't come as easy and require work is really using the best research evidence to drive treatment and to drive clinical practice and to drive your assessment, right? And so this is going to require clinicians to actually do some research, to find some articles out there on a patient they're treating, and to use that new research to change their treatment paradigm or the rehab paradigm. So this doesn't come as easy. And then last but not least is the incorporation of patient values, of preferences, and how your patient actually felt with the treatment that you gave them. And I'll give you a scenario, right? I am by trade a certified athletic trainer, and there are times where I'm in the clinic and I see clinicians working with patients who haven't gotten better, and it's been 4 weeks of treatment. And we never ask our patients, how are you feeling? Do you like this treatment? And believe it or not, there's a really high correlation between patient values and preferences and feelings and actual treatment outcomes. So when we think about evidence-based practice, if we truly want to be an evidence-based practice clinician, then we have to use our clinical expertise coupled with the most current research evidence, also while considering the patient values, the preferences, and how our patients are feeling. And it's these 3 components that make up what I call an evidence-based practitioner. So to become an evidence-based practitioner, there are different steps along the way that you will kind of have to apply, because incorporating the best evidence into clinical care really requires a systematic approach. And so that systematic approach is really Pretty simple. The first thing that you have to do is really ask a clinical question, right? So a patient comes in with an ankle sprain and you begin to evaluate that patient, and at the end of that evaluation you come up with a diagnosis. And so then after you do that, you have to ask a clinical question about either the treatment or the rehab you're going to do, or the assessment maybe that you got while you were evaluating that patient. But every good evidence-based practitioner starts with the clinical question, and that's what we're going to spend the majority of the time today on in this online lecture. But if we just look at the process, the first part of the process is asking the clinical question. The second part of that process is after you ask the clinical question, then you have to search the literature to find answers to that question. So these two really are going to go hand in hand with your literature review assignment in Kines 101. And then later on in life, you'll go to graduate school and you'll become a clinician, and these later phases of evidence-based practice will apply. So you'll get those research articles and you'll actually look at them and scrutinize them and see just how well that research was done, which is called critical appraisal. You'll apply what you found in the research to your patient. And then last but not least, you'll say, was it effective? Was it not effective? Do I need to go back to the drawing board and find something that might be more effective for my particular patient? When you do all these things, when you ask, when you acquire the research, when you appraise it and look at it deeply, when you apply it to your patient and you assess how effective it was, that is truly the process of becoming an evidence-based practice clinician. But let's go back and just start with asking the clinical question and then acquiring the literature, because those are the two things to me that are going to make you most successful in writing the literature review for this particular class. So as I mentioned, the first thing that you have to do is ask the clinical question. This first step is so critical. It is the most important step to making sure that you get the research articles that you need for your lit review. So when I think about the most important steps of the 5 in evidence-based practice, it's getting those clinicians who have curiosities and who are asking questions, because it's those clinicians that really change patient outcomes. They change healthcare. And so hopefully I am motivating you to want to ask the clinical questions. Once you ask the question, what we have to do is work on this thing right here, which I call a Pico. It is one of the best ways to actually create a clinical question and to write a clinical question. So without further ado, Pico is not a word. It actually stands or is an acronym for something. And the first part of Pico is the P. When we think about Pico and the P, the first thing we're thinking about is, what is our population? Or what is what's our patient, or what is our problem? So what are we actually looking at? And I'm going to give you a case scenario. But let's just take the medial tibial stress syndrome topic. We could say, okay, our patients would be those individuals with medial tibial stress syndrome, right? Or the problem could be an entire track team that has medial tibial stress syndrome, right? So when we're looking at P, we're looking at the primary problem. We're looking at patient characteristics such as gender, age, activity level. So the more precise you could be in this area, the more refined and more better research articles you'll get when you're doing your lit search. So P stands for either population, patient, and or problem. The next phase is what we call the intervention or the exposure. So the I, intervention, is what it stands for. So in patients with medial tibial stress syndrome, what is our intervention going to be? It could be rest. It could be some type of rehab or some type of treatment, right? So the intervention is what we are doing with our patient. The C is the comparison. So is there something we'd like to compare our intervention to? So in patients with medial tibial stress syndrome who are doing strengthening exercise, is doing nothing better? Or does doing nothing reduce their pain? So P would be patients with medial tibial stress syndrome. The intervention might be a strengthening program, and the comparison group would be maybe individuals who just actively rest, right? So we can see comparison. What are we comparing the intervention to? We have to have something to compare it to. And then the O is the outcome. So what happens? What is the actual outcome in those patients who did a strengthening program and those patients that actively rest? Was pain reduced? Did they improve in their function? Did they return to sport or activity or work quicker? What is the outcome that we're looking at? When we look at the Pico question, when we write a clinical question, we have to have all 4 components included in our question. So the P, patient, the I, the intervention, C, which is comparison, and then we have to have an outcome that we're going after in our clinical question. So let's give it a try, right? Forming the clinical question using a case study approach. And I intentionally chose something that had nothing to do with the 4 topics in the class, because I didn't want to skew you or cause you to choose a topic based on what I chose. So we're using something completely different, but I think that it applies to all of the allied health professionals that are sitting in the room or in Intro to Kinesiology. So let's say we have a patient with carpal tunnel syndrome. If you don't know where carpal tunnel syndrome is, it's in the bottom portion of the wrist. Typically happens to a lot of office administrators who spend a lot of time typing. So a patient with carpal tunnel syndrome wants to avoid surgery. And so he's asking you as a clinician if there are other non-surgical treatments that are effective. You have heard about various conservative treatments, but you're not sure if they're as effective as the surgery. So in order to figure that out, you have to kind of search the scientific literature, right? So the first piece that you have to do is you have to really look at the case study and dissect it. The first thing that you want to look at is, okay, can I identify the P? Can I identify the I? Can I identify the C? And can I identify the O? So let's look at the case study. The P in this case study is a patient who has carpal tunnel syndrome, right? So that would be the P. I would list patient with carpal tunnel syndrome next to my P if I had a homework assignment. The I would be, or the intervention would be surgery, right? This patient is scheduled for surgery, so the intervention that's going to occur most probably would be the surgery that's going to occur. The comparison, however, is conservative treatments such as rest, such as massage, such as chiropractic treatment, right? These are all conservative treatments that have been used in lieu of surgical intervention in patients with carpal tunnel syndrome. And then last but not least, we have the outcome. Not sure if they're effective, right? This could be definitely more specific, right? Effective. Well, what's effective? Reducing pain, improving function, returning back to work, being able to flex or extend the wrist. So you would have to be more specific when you're writing your Pico question if I were doing this. So if we look at the overall case study, our P is the patient with carpal tunnel syndrome, our I is the intervention, which would be the surgery, our C is the comparison, so we're comparing it to conservative treatments, and then our O would be our outcome, so a reduction in pain and improvement in function. Now, with that being said, there are ways to make these the P, the I, the C, and the O much better and more refined so that you yield even better research articles. So for example, for my P, I could say in patients between the ages of 5 and 12, or in high school patients, or in office administrators. So I could give my patients even more specific definitions, and that would narrow down the number of research articles that you get, right? Because carpal tunnel, you're going to find a million research articles, but I bet if you're more specific with the type of patient that you're actually looking at, you would even narrow that search down even more, which means, hint, hint, that when you're doing research, you'll have less research articles to go through, okay? Our intervention, we could be specific with that. I'm sure there are specific names for surgical procedures that have been used in patients with carpal tunnel syndrome. And then I've already said this, but our outcome could definitely be more specific. What is it that you want to see with either the surgical intervention or the conservative treatment? So here's what I came up with as a Pico question. I gave you the case scenario, and then I'm now creating a Pico question. In adult patients, that's my P, with carpal tunnel syndrome, that is my P still, it's the problem, are conservative, okay, that is my C, or non-operative treatments, that's still my C, more effective at reducing pain, that's my O. So where is my I? It's not on there, huh? So it should read, in adult patients with carpal tunnel syndrome, are conservative or non-surgical treatments versus surgical treatments more effective at reducing pain in patients with carpal tunnel syndrome? So we'll have to work on writing the Pico question. Now, an awesome thing about writing the Pico question is you can actually take things out and use them as search terms in your search toolbox. So for example, carpal tunnel syndrome becomes a search term. Conservative, non-conservative, or non-surgical treatments becomes a search word. Surgical intervention becomes a search word, and pain obviously becomes a search word. So now you've just created a clinical question. You now have search terms from that clinical question that you can use. And I guarantee that you will have less research articles, but you will have a small group of research articles that will truly help you focus and write your literature review. So for your assignment, for me, you are going to be participating in a discussion board. And the first thing that I'm going to ask you to do in that discussion board is to create a Pico question using one of the assigned topics in Kinese 101. You're going to respond to at least 3 peers' Pico's questions and make suggestions on how they can improve the Pico they created. So you're going to create a Pico question, your peers are going to post their Pico questions, and you have to respond to 3 peers, giving constructive criticism, of course, about how they could improve either their P, their I, their C, their O, or their overall wording on the question. Once you have 3 responses to your Pico question, then I want you to refine your Pico question based on the feedback that you got, and you're going to turn in your final Pico question to Professor Ward. Again, these Pico questions are based on the assigned topics in Kinese 101, the 4 topics that I talked about in the beginning. With that being said, I just want to say that becoming an evidence-based practitioner takes work. Becoming a good writer also takes work, but the best way to become a best writer is to start with the question, to start with a clinical question. Because that clinical question really helps you get search terms, and then you have these search terms that are so specific, and it yields such a smaller research article count, and it becomes less daunting, it becomes less stressful, and it helps you really truly write a more succinct, a better literature review. So I hope that you will use this process as you're beginning to kind of think about what it is that you want to do for your literature review. And if you have any questions, of course, feel free to stop by or email me with specific questions on creating the Pico. My last challenge to you all is that as you begin to get ready to go into healthcare, just remember that being and becoming an evidence-based practitioner is so crucial to patient satisfaction. When we go into a healthcare dominated profession, we are really servants in essence, right? Like part of our job, not maybe in the description, is really to serve our athletes or our patients. And so in doing that, part of serving our athletes is really knowing what the newest and the latest and the greatest treatments are for our patients, right? That's the only way that we really get good outcomes. So I challenge you to use this 5-step approach, in particular the writing the question and the actual searching of the research articles. Anyways, thank you for listening to me. I hope this has been helpful, and I look forward to seeing you guys in one of my courses that I actually teach. Thank you so much.